came into this role at Northumbria University following an extensive time undertaking clinical trial research within the NHS. So before my life as a nurse, I was a science graduate, so had some underpinning knowledge. And my first nursing role was within the intensive care unit, where by chance I met a colleague and we were doing a research project about sepsis, and I then became part of that research team. I then moved at the creation of the topic-specific research networks to work within the Diabetes Research Network in the northeastern Cumbria, where I was a study coordinator. Then went on to a role where I actually managed and was the sister of a clinical trial unit in Newcastle upon Tyne. Within that role, obviously, it was very research focused, but there was a lot of teaching and education as well. So the role here at the university as an academic enables me to satisfy both educational aspects of my career and also research interests that I may want to pursue as my role as a PhD student. When I was in a role as a research sister, it was of an early phase clinical trials unit, which means medications and devices which are being trialled for the first time in humans. So very early stage research and quite high complexity of new medications. As a manager of that unit and leading and managing a nursing team with all of the requirements of that according to our professional code, but also setting up, managing, running and closing out clinical trial studies. Within that, having your own portfolio of studies where you had a lot of autonomy to manage those studies and really act as a patient advocate, recruiting patients, putting them through the trial procedures and then following them up afterwards. There's no formal qualifications required for a clinical trial nursing role. However, I applied for a Master of Clinical Research, and through my work I was able to apply for a Medical Research Council scholarship to fund that research and to fund my time away from practice. And as part of that, there was a project that had to be undertaken. So that allowed me to move from this role as a clinical research nurse, where I was delivering a protocol written by someone else, to actually answer my own research question and become a nurse researcher, where I developed the protocol and I submitted the ethics applications, recruited the patients, conducted the actual study procedures, wrote up the research, analysed the results and then published it. So there was these two elements to the role happening at one time. A typical day on the clinical research facility for a clinical research nurse, we would have a nursing handover, which basically enabled the team to come together and plan the work for the day. And every day was different. Every day would involve maybe a different trial or a different group of patients across a really wide range of disease areas. The main thing about the nurses that worked within that unit was the variety of skills that they had, actual clinical nursing skills ranging from venipuncture, cannulation, phlebotomy. The main thing about the role professionally is that in that role you really are the patient's advocate. As a clinical research nurse, you're sort of the fulcrum around which all of the trial activity happens, and you are the point of contact for the patient and for the clinical team, and if it's pharma trial, the pharma company as well. From a personal point of view, the drivers within the clinical research nurse career are that it enabled me to develop myself academically and professionally. My PhD really does build on my previous career, which was around researching people living with diabetes and people at high risk of diabetes. It's a huge health priority, prevention and management of diabetes. Because I've come from a background where I've constantly been at the cutting edge of research and technology, I'm actually looking at wearable technology and how wearable technology could have an impact on motivating behavioural change in people who are at risk of developing diabetes, and using something I think that draws from my clinical research nurse career and also my career as a nurse researcher, because I'm doing mixed methods, bringing together quantitative research skills and also qualitative research skills to understand what do these devices physiologically do to people, but actually what's the lived experience of using this equipment as well. The things that I enjoy most about the role are that through the research that I've done and through the patients that I've met, I've seen genuine changes to people's lives through what research can do for them, and being able to bring that enthusiasm and bring that knowledge into a teaching environment to share that with students is a really powerful thing to enable our nurses of tomorrow to understand what the impact of research really is for patients that we care for. If you're looking for a career as a clinical research nurse or within the field of nursing research, I think the first really important thing to do is to find an area that you're really passionate about. To speak to the research teams in your area, speak to your R&D departments and find out whether there are informal or formal opportunities. So you could spend some time with some research teams or maybe shadow some of the nurses who are involved in clinical research nursing to find out that if this is a pathway that's right for you.